Thank you. This is a question for the Minister of Health. We've been hearing reports over the weekend about people being on hold with 911 calls because no BC ambulance dispatchers were available to take their calls. I know the province is in the process of hiring 30 additional ambulance dispatchers, but I guess the question is this enough? And has the review group made any recommendations about how many dispatchers are actually needed and when or if you'll be able to hire more?
Well, you're right, Lisa. We're in the process of hiring both more ambulance paramedics and more dispatchers and adding ambulance capacity both in urban BC and across BC and rural and remote communities as well. You've seen that reported. We're in the process of hiring, and we were in the process of hiring in the hundreds of new full-time paramedics in advance of this, and we're hiring a bunch more. There are from time to time challenges in terms of the resources and dispatch, but we've been adding in weekends when we've been under significant number of calls for ambulance paramedics. We've been adding and supporting ambulance paramedics with both management services and other supports at both the dispatch level and others. And certainly it continues to be a challenge because we're seeing right now in the healthcare system an increased call on ambulance care services. We've seen a lot more ambulance calls than we saw in the pre-pandemic period and through a good part of the pandemic, and we're responding to it by adding resources. And I think the issue will be, I think, addressed on the dispatch level by the adding of those resources. And it's my intention and it's our expectation, I know it is, for BC Emergency Health Services to be ready and to provide care when people call for 911. And we're adding resources to see that happens. So a lot more ambulance paramedics, a lot more dispatchers. As you saw last year, we added air resources. Those are right now fully occupied, and we're adding more of those to deal with transfers from the north. So BCEHS has been seeing in the recent months, as you know, record a number of calls, and we're responding to it by adding resources to make sure people get responses. And on the details of the weekend, I'd be happy to get you some detailed responses as well.
Lisa, did you have a follow-up?
Yes, thank you. So, Minister, do you believe then that these 30 ambulance dispatchers that have been hired, these additional ones, that is enough to cover the kinds of waits that we saw over the weekend?
I believe so, and we're in the process of hiring those and adding resources. And clearly, the support at the dispatch level is really important, as is having the ambulance paramedics on the ground, because our dispatchers and people who provide support are supported. It's a whole operation. It's not just the dispatchers. But yeah, that's a very significant increase in the number of dispatchers, and that's going to help significantly, as have other steps that we're taking. I think one of the most important steps, and it's really challenged right now because of the challenge in emergency rooms and some of the challenges in some regions of the province with COVID-19. But one of the most important ways is to ensure that ambulance get in and out of emergency rooms more quickly, and those are some of the measures that our team, our leadership team, of BCEHS have put into place during busy weekends throughout the summer, especially in the subsequent weekends when we had heat waves in July and in August. So it's a big challenge, but we've added since 2017 massive new resources to the BCEHS. With the exception of mental health and addictions, it's received the largest increases of any area of the Ministry of Health in that time, and we continue to do so now to meet this test. And we're hopeful as well that as we return, and we hope to return to more normalcy in our primary care system, that all of that will also relieve some of the pressure on BCEHS.